My name is Savannah Patton. I've been in contacts or glasses since probably about 5th grade, so at least 18 years now. I played sports growing up, so I was consistently wearing contacts rather than glasses, and having to constantly put in the contacts every morning, take them on at night, having to make sure I have enough pairs with me, it's just really become a hassle, and it's also very costly.
So let's talk about LASIK. LASIK is the most common form of laser vision correction that we do. We use a laser to reshape the cornea. The cornea is in the front part of the eye. It sits in front of the colored part of the eye, and it's where you'd wear a contact lens. If you think about the cornea like a textbook, we use a laser to separate the cover of the book from the pages of the book. We open up the cover, that's called the flap. A second laser is used to reshape the pages of the book based on your prescription. We put the cover back and you go home. 90% of your vision is back to normal the next day, 98% in a week, and you're back to your baseline a month after LASIK. LASIK requires the latest and greatest state-of-the-art lasers. There's 2 different lasers that are used to do the LASIK procedure. The first one is called a femtosecond laser. This one creates the flap in the cornea, and that's the basis of making the procedure called LASIK. The second is an excimer laser, which actually does the treatment part of your surgery. So the 2 together are paired up to create a seamless outcome for you.
The main thing that made me really go through this was being at a bachelorette party about a month ago, and we were on a boat, actually maybe about 2 months ago. We were on a boat and I lost my contacts while we were on a boat. Couldn't see, couldn't enjoy the trip the way I'd like to. So that was really the point where I came back home, spoke with Dr. Patel, and I told him this is finally the time, I'm ready for LASIK. So I've known Dr. Patel now for a little over 5 years, and he's not only an amazing surgeon, but he's also just a very easy guy to get to know, very personable, and I feel like that's very important to me, having that relationship and being able to really ask him questions. He sat me through and discussed the entire process of it, and he just genuinely really cares about his patients.
So during the procedure, most people will feel a little bit of pressure, a little water, but overall it's a pretty comfortable procedure. Immediately after the procedure, you should notice that you can actually still see things. It should be better than it was before the surgery, but you're going to feel like your vision's underwater or in a smoky, cloudy bar. That sensation begins to lift by the time you wake up the next morning. So when we think about LASIK, we want to make sure that your prescription has been stable for at least a year before we consider doing surgery. LASIK is designed to be an eyeglass or a contact lens replacement. So you take your eyeglass prescription and we zero it out with LASIK. If your eyes have been changing before you have LASIK done, LASIK is not going to stop that from happening. Every surgery has risk. There's nothing that is without it. There's a 1 in 15,000 chance of bleeding, infection, or loss of vision. That means every person that gets struck by lightning, 1 person will lose vision from LASIK. The next complication is a flap-related complication. As we talked about, that cover of the book that we put back is very delicate for 7 days after LASIK. Any type of eye rubbing, poking, or touching can cause the flap to dislocate, and patients can lose vision from that. And finally, dry eye. 100% of patients after LASIK will experience some type of dry eye disease. While you will become dry after surgery, most people will recover by just using over-the-counter artificial tears over the first 3 to 6 months. Less than 2% of people will need prescription dry eye therapy or treatment beyond 6 months.
So I'm actually not at all nervous. I'm so excited for it to finally not have to wear glasses or contacts anymore. So it's been more of just an excitement rather than nervousness. I slept very well last night knowing that I'm actually going to wake up tomorrow and be able to see a lot better without putting on glasses. I just want to be able to see better. I want to be able to wake up with someone that has 20/20 vision and they wake up in the morning and they don't have to put in contacts or glasses, they can just see. So just imagining that, waking up in the morning and being able to see freely is just unimaginable to me. So that's what I'm really looking to achieve.
One of the other things that you have to keep in mind is that sometimes the laser will overcorrect or undercorrect your prescription. We always err on the side of undercorrection, so a small number of patients will need what's called an enhancement done, and that means a retreatment. After we do your original treatment, let's say the laser gets 80% of your treatment or 90% of your treatment, you might need a little fine-tuning 6 to 8 weeks later if there is any sort of residual prescription left. For the most part, you're still pretty functional. It's better than your vision's been, but just for that little fine tuning. After the procedure, usually patients experience great vision for distance correction for many, many years to come. In your 40s, your eyes will naturally change and you'll need reading glasses like everybody else in their 40s. As you get even older into your 60s and 70s, most people will start to develop cataracts. So the goal is to keep your distance vision as good as we can for as long as we can, and that's the goal for LASIK.
I feel great. I do not feel like I just had a surgery done. Immediately opening up my eyes after the surgery, I couldn't believe that I could already see, probably just as well as I could from my glasses, because my glasses are a little bit old and a little bit smudgy. So right now, the vision that I have is definitely 90%. Like, it feels great, a little hazy, but the fact that I'm able to actually read a bag over there right now, I know I could not do that without contacts or glasses to begin with. So overall, feeling great.
Savannah, everything went absolutely perfectly. You were a perfect patient, you did exactly what we needed you to do, and I don't think it could have gone better.
Dr. Patel and everyone in the room just made it so enjoyable. It honestly flew by. I can't believe that it was only, it was 10 minutes or so, 10, 15 minutes. It felt like it was 5. Amazing. I mean, everyone is just it feels like a family here. Everyone gets along so well, and everyone just made me feel so supported in the room. So overall, it was an amazing experience.
Savannah, isn't it amazing? Think about it. You literally got off the table and you can see all of us. We probably look like we're underwater or in a smoky, cloudy bar, but when was the last time you woke up from bed and were able to see like this?
So when he told me, don't worry, you're not going to see a little green light for a second, that's totally normal. It made me feel better, because for a second there I couldn't see anything, and he's like, if you don't see it, it's completely fine, very normal. So the entire process, he knew exactly how I was feeling before I even said it out loud. So he just knew exactly what was happening, and it made me feel very supportive.
So today, at your one-day post-op visit, you can already see what an amazing improvement you've had. You were able to drive here by yourself today without needing anybody, maybe some sunglasses, but that's about it. And as we've talked about yesterday, 90% of your vision's back to normal, and your measurements from today most certainly show that.
So before the surgery, it's night and day. I would say I can see about 90% as well as I would with contacts or glasses on. So very good 1 day later. No redness, swelling, pain, inflammation, anything at all. So I feel actually very good for 1 day post-surgery. I would do it all over again in a heartbeat. It was very seamless. Dr. Patel made it so great, and then also everyone else at the staff.
So as we looked at, remember what we talked about beforehand, that this is going to be a contact lens replacement. When you were wearing your contact lenses, you were able to see pretty well. And look at it, you're 20/20 without any glasses or contacts now for the first time in the past, 18 years?
Everything's going to be a lot easier, I feel. I'm not going to have to worry about losing a contact or bringing my glasses with me everywhere, packing an overnight bag, and also just the cost factor. Contacts get expensive, glasses get expensive, so that's what I'm definitely most excited for, is just a much easier, seamless process of being able to see. I understand that it's a surgery and everyone gets a little bit nervous about surgery. I was a little bit nervous as well, but overall I would do it all over again. Just the impact of my life and having to be able to see without contacts or glasses is much more important than getting nervous about a surgery, I feel.
So our next checkup will be in a week. We'll make sure that everything is healed in perfectly with your flaps and that you've been doing everything we've asked you to do post-operatively. After that, I'll be seeing you back 6 weeks later and 6 months later. Those will be our 2 post-op visits. If everything looks perfect by then, you should be good to go for going forward.
I would recommend surgery, LASIK surgery, to anybody wanting to get it. I'm super happy to be able to drive over here and actually be able to see 90% already, just not even a day after getting surgery. So overall, just pure bliss.
Most importantly, go out, enjoy your vision, and just remember how amazed you are and how amazing this moment will feel forever.